Identifying key elements for successful public procurement practices in the healthcare sector is the name of the third work package of the European project Procure. This work package is led by IACS, which is the Aragonese Institute of Health Sciences in Aragon, Spain. The objective of the Work Package 3 is to identify a set of criteria formally agreed at the European level oriented to assess the potential success of a public procurement process in the healthcare sector. To do so, the Delphi methodology is used, about which my colleague Maria Jose will give you more information.
Following a Delphi methodology, we ran a 2 days face-to-face meeting with experts who have already participated in the first and second online round. In these 2 days, experts from different countries, organizations, type of stakeholders, suppliers, promoters, procurers, regulators, and so on, we met to decide it. The final categories and criteria that a healthcare public procurement process should follow to achieve the aim of the public procurement. Over those 2 days, it's been discussed different issues, and the job they have to do was to rephrase and to make sure that all the categories and needs are understood by all European, by all people and organizations in terms of public procurement.
So this afternoon, we discussed about several criteria we should take into consideration. One of the things which for me it was more interesting was about monitoring and execution, because there seemed to be like lack of consensus between people, participants, and it says a lot of ourselves in the way that we have a lot to do, a lot of working in this field to engage stakeholders and accomplish the execution of the contract.
I think one of the main aspects is key aspects is that we agreed that it's not only about economic side also, but what we must focus is on the value of the procurement in the healthcare systems. So we take into consideration the impact on the patients, the impact on the healthcare systems. So we favor, so we give space for innovation and improvement.
In the context of few resources, we should find an equilibrium, a kind of trade-off between the economic situation and the need for the patients to get access to treatment, to high-quality treatments. This obliges the governments and the public payers, but also the insurers to find ways to implement policies focused mainly on efficiency. And there are ways to do that, like, for example, a very careful evaluation of the treatments to prioritize those that are more effective, those that have good value for money, and those that are affordable and accessible to the patients.
We have to train, we have to learn, we have to study the mistakes that we made in the past. And we have to train all the people that in the administration work in the public procurement process and how to approach the different things and how to apply the regulation to that. And also the training for all the suppliers. They have to understand that they have to be ready. They have to have the stock enough. They have to have a good plan to make to facilitate to the procurers, to the healthcare systems, all the needs that they need in exceptional situations.
the main challenge is to make not public procurement as a very strategic topic. After all these discussions, we see that public procurement in the health sector is a strategic lever to improve healthcare, to improve patient outcomes, to improve the health system for all citizens. So procurement is key, but one of the main challenges is that at some point, procurement stays an administrative procedure, and we do not manage to make this change happen. So I hope that we will be able to do that with this project.
I can see a lot of challenges in their implementation. First of all, we need an agreement about all the stakeholders and also the states members of the UE to identify our needs and to identify what needs to be improved. And I think in that regard that we are different countries with different problems and different needs, and we have it would be a challenge to put all this together in order to decide which way we need to go. Another challenge, I think, is the professional resources. We need a lot of more personnel which is trained and capable for working public procurement. We can see, or I think that especially small institutions, they have a lack of or a shortcut of personnel and resources who are experts in public procurement.
The work done by the experts has been excellent. We already have a final version of the Delphi questionnaire. The results are being processed and will be collected in a deliverable. Also, they will be used to improve procurement practices at European level.